Hello, friends. So today we'll talk about various types of reviews. Now, there is always this confusion of what exactly is a narrative review and what is a scoping review. And obviously, um, most of the researchers would know what a systematic review is, but most of the time, the confusion would be between narrative review and scoping review. So let's try and simplify this. Now, when it comes to narrative review, so it's also called review articles, which you see quite a lot in the journals. So these review articles published are basically narrative reviews. So when it comes to the research question, in narrative review, it's kind of pretty broad, and so is in the scoping review. But in systematic review, it is very focused. When you think of the literature search and narrative review is broad, and scoping review is broad as well, but in systematic review, it is focused. And when you start summarizing, once you've gathered all the literature and you've shortlisted the abstracts, and out of those abstracts, you've included your articles which you will start analyzing. So when you summarize that, in narrative review, it is broad. In scoping, now that's where the difference lies. In scoping, it becomes a lot more focused than the narrative review. And when you start summarizing this in systematic review, it is very, very specific. When you look at the structure of that article, um, a review article would be descriptive. I've done a review on a review article, so you can have a look. So when you think of the general review article, it would be basically an introduction, the body, and conclusion. But when it comes to scoping review, that may not be the case. It is the description is more in detail and focused. It could be in the way of qualitative or quantitative type. But if you think of systematic review, it is either quantitative, which is meta-analyses, or it could be qualitative, in terms of thematic analysis. Uh, when you think of the conclusion, so like what did you arrive at after doing this review? So like in a narrative review, again, it can be broad, which needs to be explored further. The scoping review is again focused there, that look, this is what we've identified. Now, this needs to be assessed further, or a future clinical trial needs to focus on this aspect. And systematic review is again very specific. Now, when you look at the future direction, like how does these reviews help us as a researcher or as a clinician? So when you think of when you read a review article, it could be a good learning material, that these are the things which can be considered in your clinical practice or as a researcher for your future trial. But then if you really want to dig deep into it and get to more specific aspect of it, then that's where the scoping review is. So say like as I mentioned previously, scoping review is more focused compared to the narrative review. So what could that lead to? So you've identified certain specific points there. Now, either you want to do a systematic review, say with meta-analyses, or you can draft a research proposal based on your scoping review. So that is how important the scoping review can be. But when it comes to the next step of the future direction, based on the outcome of the systematic review, that is basically at the top of the hierarchy of research, and this can be used as a recommendation. So this can be included in all these guidelines, and then this is like literally actioned. So the outcome, the findings of the systematic review is basically recommended. Now let's try to differentiate this, or have a better understanding of these reviews based on the example. So say you are trying to look into the current literature on the biomarkers. It could be of any disease, for example, anything like, you're trying to identify what are the biomarkers used to arrive, clinically indicated to arrive at a clinical diagnosis. So you are doing a literature review where you're gathering all the literature included there. Now, in this, you are including anything like, whether it is a randomized control trial or an open label study or even case reports or even, studies with a smaller sample size. You're including everything there. And then based on your search, you arrive at a conclusion that these are the biomarkers which has strong evidence base. So the narrative review tells you that if you're doing a proper narrative review, you can arrive at a conclusion that these are the biomarkers which has strong evidence. Now, say you've identified 3 or 4 biomarkers. Now, out of these 4 biomarkers, now you want to know which one is commonly used in clinical practice. And that is where the role of scoping review is. Now, in scoping review, what you would do is you would dig deep and see that, okay, now these are, say, the 4 common biomarkers. Which one is more sensitive? Which one is more cost effective? Or you've identified based on your review that these are the 4 commonly used biomarkers. Scoping review will help you in identifying that why is it that these 4 biomarkers are indicated based on the literature. Now, on your scoping review, you can then arrive at a conclusion that this particular biomarker is more sensitive than the other biomarkers, or this particular biomarker is widely used because of its cost effectivity. And that is where now maybe you have you started with 4 biomarkers in your narrative review. Now you have narrowed it down to 2 biomarkers now based on the sensitivity and the cost effectiveness. Now the next step is, okay, now you know that these are the 2 widely used, but amongst these 2, irrespective of the cost, which one is the most accurate? And that's where you would do your systematic review, where now you have you started with a broad literature search, you narrowed it down in your scoping review, and then now you're further narrowing it down, where now you are very specific of what exactly you're looking for. You are looking for the most accurate biomarker to arrive at a particular diagnosis, and that's where you do the systematic review, and then you do the meta-analyses and see that which has whatever it is, like if you're looking at the odds ratio or the relative risk or whatever it is, then that's where you are arriving at a conclusion that yes, this biomarker is the most accurate. It has maybe 99% or 100% sensitivity, or maybe say 90% specificity. And so this is the biomarker which is most accurate, which will give you the most accurate diagnosis. And that is where the role of systematic review is. So I hope it's a bit clear now that where is the role of these every type of reviews have their role in research. So if you're doing an excellent narrative review, you may not need a scoping review. And again, if you want to do a scoping review, you don't necessarily have to do a narrative review to then do a scoping review. You can straight away do a scoping review and then see what that leads to. Whether you want to do, the next step is whether you want to do a systematic review with meta-analysis, or you want to draft a research proposal and then apply for ethics or funding or whatever. So again, and for that, you don't need a scoping review. If you're doing a very good, robust narrative review, you can then draft a proposal based on that, and then you can apply for ethics or funding to do that particular clinical trial. So it is about how well you do that, but this is how you can differentiate between a narrative review, which is also called a review article, or a scoping review, or a systematic review. I hope this was useful. In my next video, I will talk in depth about scoping review. So watch out for that space. Thank you very much for your time. Take care. Bye bye.